February is National Heart Health Month, and 22 News and Baystate Health are partnering to remind you to get heart healthy. Joining me this morning is Robert Berry from Cardiac Rehabilitation and Wellness at Baystate Medical Center to share more. Robert, it's nice to have you here.
Thank you.
It's been really great to talk about how people can be more heart conscious, heart healthy, especially given that it is National Heart Health Awareness Month. Let's talk first about the rehabilitation program. After people have suffered a heart attack, how can you help them?
We have a comprehensive program at Baystate Medical Center. It's been open since 1978. It's one of the largest and most comprehensive in the western half of the state. We see people, we talk about 3 phases of cardiac rehabilitation. And the first phase happens immediately after their event, whether it's a heart attack, whether it's open heart surgery, valve repair, whatever. And we'll go to their room while they're in the hospital and we'll talk to them about what their risk factors are, what kind of lifestyle modifications they might want to consider making to avoid having another event down the road. We get them up and we get them moving, but really the big part of what we do on the rehabilitation side would come in what we call phase 2. More recently, it's being referred to as early outpatient cardiac rehabilitation. So people come to our gym, which is it's a pretty good sized gym. It's about 4,000 square feet. Looks kind of like a commercial gym.
That's a good size, 4,000 square feet, yes,
yeah,
for sure.
Yeah,
a lot of equipment.
Yeah, we have about maybe 16, 17 treadmills, about 16, 17 bicycles, rowers, weightlifting equipment. Pretty much anything you've seen in a commercial gym, we probably have. Because of the population that we serve tends to be, or it can be a little bit older. They might have some musculoskeletal issues that we need to sort of be aware of and concerned with. So we have some things that you may not have seen in a commercial gym that helps us get our job done without exacerbating some other condition that might exist.
But people can feel so comfortable when they're there because they know that they're monitored, that they are in a safe place. So if something ever were to happen, or they know something did happen in the past, they know that they're in good hands.
Exactly. One of the biggest predictors of who's going to have a heart attack is who's had one in the past. So if you've already had a heart attack right off the bat, you're at more risk in the future. If you come into the facility that we have continuous electrocardiographic monitoring, the ECG waveform. So everybody who's in the early outpatient program would be wearing that while they're exercising. We have either an exercise physiologist like myself or one of our registered nurses with a critical care background watching that monitor the entire time. We also get your blood pressure before exercise and then during exercise. And the staff kind of walks around the room and makes sure that you're doing okay, that you feel all right. We ask you on every piece of equipment, how hard does this feel? And what we're trying to do is we're trying to get people into the habit of exercising and sort of monitoring their own intensity. So when the early outpatient program ends, they'll have a good idea of how to do this on their own.
But it really gives them peace of mind, for sure.
Absolutely.
Now, it's important to mention, too, it's not just the rehabilitation side. Even if you've never had a heart attack or had open heart surgery, if you just want to go and prevent anything from happening, you can do that as well, and really sit down with someone and learn about what you can do to take the steps to be healthy.
Absolutely. We call that the phase 3 program. It's the wellness program, and it's for people that maybe they have a lot of risk factors for coronary artery disease, or there's some reason why they're not comfortable starting an exercise program on their own. They just feel like they want a little bit more supervision, a little bit more monitoring. They would come into the same facility, same staff. The hours are a little bit different. We do keep them separated. All the same equipment. When they enter that program, they have a one-on-one meeting with one of the staff members, whether it's an exercise physiologist, whether it's one of the nurses. And they'll sit down, they'll go through their medical history with them, find out what their risk factors are. They'll ask the person, what are your goals? Are your goals you want to lose weight? Or your goals you want to compete in a 10K and you just don't know how to start? Are your goals, your doctor thinks that you're pre-diabetic and you don't want to go on...
just to be more healthy in general.
Exactly.
Right.
So once we figure out what your goals are, we bring you into the gym. We would hook you up to the ECG that very first session just to make sure that what we're seeing is what we think we should be seeing. From that, we design an exercise program unique to you, and we're with you every step of the way. The big part of what we do is really education. The exercise is the tip of the iceberg.
Yep, but it really makes people feel like they're in great hands, that if they're in a place that is safe and they feel like they can exercise and know that someone is always looking out for them. Now, really quickly, Robert, we also just want to mention there's one take-home message, one thing you really want to drive home, especially being that it is Heart Health Awareness Month. What is that message?
I think that people really should know what their risk factors are, specifically what is their blood pressure. Their blood pressure should be as close to 120/80 as possible. They should know what their cholesterol numbers are. For most people, you want that number under 200. If you have a prior history of a cardiac event, those rules change a little bit, but you should always know what those numbers are. And the other number is that most people should be getting between 150 and 300 minutes of moderate intensity aerobic exercise per week. So that's 30 minutes 5 times a day for health, 60 minutes 5 times a week, I'm sorry, I misspoke, for weight loss, and kind of where you fit into that. You can break that up into very small blocks of time if you're busy like everybody is.
Right. And of course, if people have any questions, they can contact you, but it's good to know where they can go to feel like they're at a safe place to work out.
Absolutely.
And of course, to rehabilitate themselves as well. Thanks so much for being here, Robert.
Thanks a
nice
lot.
to have you. And you can visit baystatehealth.org to learn more about the cardiac rehabilitation and wellness services at Baystate Medical Center. You can also call them at 413-794-7024.